Can you hear me all right? Can you hear me all right?
Yes.
Yes, you can. Good.
Yes.
Lovely. Okay, so welcome everyone to Medical Needs in Schools Suffolk. Today's workshop is how to write a good IHP. Today's workshop is going to be recorded, so if you're unable to join us and you're joining us now, listening to it back, welcome. We're going to upload it onto our website, and that will be after probably in the next couple of days. So as you join, do please join with your microphones and your videos turned off. There will be an opportunity at the end for questions, but please also do use the chat bar, and I shall be monitoring that throughout today's session. So I'm now going to introduce our speaker, Dr. Helen Griffith. She's a consultant clinical psychologist specialising in working with children with medical needs and their families. She's based at Oxford Children's Hospital, and she has worked on the Medical Needs in Schools project since its inception. And I think, Helen, I'm right in saying that's probably about 5 years ago now, which is a bit scary, really, isn't it, to think the time has gone so fast. Helen is passionate about interprofessional working to best support children with medical needs to reach their full potential. She also works with professional organisations to ensure the needs of this group are highlighted at a policy and strategy level. So welcome, Helen. Thank you for giving us your time today, and I'm going to pass over to you to tell us all about this very important piece of our working, how to write a good individual healthcare plan.
Thank you so much, Kate. That's a lovely introduction. I feel very humbled by such a nice intro. Yeah, I'm Helen. I'm a clinical psychologist based in Oxford, but I've worked on the Medical Needs in Schools project both in Oxfordshire and Suffolk for a few years now. And one of the things that I think is a real strength of the project is education and health coming together to support the needs of the young people who have medical conditions across the domains of psychological well-being and physical health outcomes and their education. And really that's what underpins the whole concept of the individual healthcare plan. And I believe that it's a really important part of getting it right for young people across all domains, although of course the IHP usually sits within the school setting. So I'm going to talk a little bit about IHPs, but I'm going to assume some prior knowledge of them and really focus on what does a good IHP look like, when would we use it, and what can we put in it to make sure it's to maximise the benefit for the young person and their family within the school environment. Nicole is going to move the slides for me, so if you wouldn't mind moving on, please, Nicole. Thank you. So in terms of a brief overview of what an IHP is, many of you will know it's a document that's co-constructed by school, the family and other professionals involved in a child's care, really as a place to store all the important information and knowledge about that child's medical condition and how it interfaces with their life in school, but taking into account their physical health needs, their mental health needs, and how that interacts with education. So not all children with a medical condition will need an IHP, but you might find it helpful for children where maybe their needs are interacting with school and you think that having a plan for best supporting that child would be helpful. Although there are some templates out there, the IHP can be adapted and it should be individualised to each pupil to think about what's most important for them, what do they most need from the IHP, and actually individualising it so that it meets that young person's needs is far more important than sticking to a template. However, there are lots of excellent templates out there. The Department for Education has a standard template which you can see in the Supporting Children with Medical Conditions in Schools document. But lots of charities have templates, and I'm sure that Kate and MNIS Suffolk can point you in the direction of templates for certain conditions. It's most important to remember also that the IHP can be used for children with both mental and physical health care needs, and actually a good IHP will consider psychological well-being alongside any physical health conditions that a child has. Thank you, Nicole. So what's the point of an IHP? It's an extra bit of paperwork, and nobody needs extra paperwork unnecessarily. So it's really important to pin down why we use IHPs. We want to make sure that the young people who have long-term and complex medical conditions are well supported, and that we really know what their needs are, not just in terms of their medication, but how they feel about having a health condition, how it impacts on them in school, how it might interface with their educational goals. So not only are we thinking about monitoring interventions and their medication and so on, but we're also thinking about their holistic needs in terms of their psychological well-being. Some of the specifics that we might want to put in an IHP are things like medication. So where do they keep their inhaler, their tablets, who administers them, what happens if a young person doesn't want to or feels unable to have access to their medication on a certain day, but also thinking about what are the physical and psychological impacts of the condition. So things like, how does a child want their condition to be talked about? Are they happy for it to be openly discussed, or do they prefer a more private discussion? Thinking about things like how they feel about being maybe perceived as different within the school environment and how that's going to be managed. Does the child need any reasonable adjustments? So psychologically, does the young person need to see a school counsellor? Do they need extra time one-to-one with a teacher to discuss their feelings and so on? And what are the practical considerations that a child needs? So do they need a reduced timetable or adjusted timetable? Do they need to leave lessons early to get around to school, and so on? We also need to know what's the demand on the family in terms of appointments. So are we expecting the child to have regular outpatient appointments? Might they have unexpected admissions? And these things that families tell us are really important for the school to understand what the attendance of the child might need to be in terms of meeting their medical needs. And in terms of possibly thinking about smoothing any transitions where perhaps a young person is being asked, okay, why did you miss school on that day? And families and children tell us that can be really stressful. So the IHP is the place to document all of these things, just to smooth out any problems, I guess, in terms of the child's care. So if we have a good IHP, what are some of the advantages? So we know that all the child's contacts are in one place, and that can open up a conversation about consent to contact different professionals, to share information, super important. Knowing where the gaps are, so looking at the child's holistic needs and is there anybody missing? And thinking about ease of communication between professionals. So if you have all that in one place from the start, it's much more easier to get the information that you need to manage school difficulties. Oh, Nicole, can we just go back to that slide? Sorry. Is it possible to go back?
Sorry, Helen, it just keeps jumping around. Bear with me.
That's okay. So I was just going to say on the previous slide, thank you. The IHP can be really useful perhaps where there are some people maybe on different pages with what a child needs, and where a family has maybe been sort of relied upon to translate from medical appointments back to school, and sometimes things can get sort of lost in translation or communication, as they say. So it can be helpful to really pin down what everybody involved in a child's care thinks about what input is needed and so on. Make sure that the information passed between school, home and the medical team is accurate, but also develops a shared rationale. So particularly maybe when advice is sometimes counterintuitive. So for example, keeping a child in class when they might be expressing pain, for example, making sure everyone's on the same page and that the child and family are really on board with what the plan is and the reason behind it. Thanks, Nicole. So when is an IHP most helpful? So when children are not optimally accessing education, and maybe a child is anxious or nervous about being in school, and maybe that's over and above what we might expect from their health needs. When there's uncertainty about the medical condition or advice, and when we're not really sure who should be taking what decisions, for example, when to send a child home, when to give medication. When there's anxiety, even in the staff team or in the child and family, in terms of managing the condition. So maybe you're thinking about, if a family thinks a child should be inside during break times, but the medical team feel that there's no reason for a child not to be outside. Those kind of things can really get delineated very helpfully in the IHP. And of course, where the IHP is having multiple impacts, whether the condition's having multiple impacts on a child's life, and IHP can really help to smooth some of those things out. Thanks, Nicole. So some of the common questions I get asked is, should we have an IHP or should we have a risk assessment or an EHCP? And hopefully the next slide will delineate some of those. So an IHP is different to a risk assessment, which is of course focused on maybe an environmental assessment that keeps the child safe, but it might not support with access to activities. It might, of course, think about the environmental factors which might support access, but it might not think about things like the psychological benefits or barriers to a child attending. So an IHP would be in addition to that in terms of thinking through, you've got the risk assessment, but actually what conversations does a child need to have to be able to access the activity. In terms of an EHCP, a child might have both. Obviously, it's got quite a high threshold for a child to be able to access an EHCP, and often the things that are delineated in the EHCP are, Nicole, I don't know if we can go back, sorry, I know it seems to be moving on automatically here, so apologies for that, everyone. But in terms of the EHCP, often they are long-term needs and long-term supports that need to be delineated at a statutory level, whereas an IHP is much more about the child's needs right now, and those conversations will change pretty regularly, certainly in terms of their psychological needs, their emotional needs, and you might be pinpointing those in a much more specific way as opposed to the EHCP. So often a child with a medical condition might well have both, but that should be delineated by the team looking after the child in terms of, we don't want to duplicate, we don't want to do unnecessary forms. Thanks, Nicole. So a good IHP will reduce the feeling of difference through thinking about what does that child need to feel comfortable in the school environment. It will aid school reintegration, attainment and achievement by minimising disruption to the young person and ensuring there's a plan when they can't be in school. It will improve the management of the medical needs because we might be maybe sending children home less and making sure that they get the right medication at the right time. Through reducing feelings of difference, we'll have increased self-esteem, increased social interaction, and importantly for the school environment, when we are also tight on time and resource, putting in the work at the start of drawing up an IHP will ensure the effective use of resource over the long term. And that's to everybody's benefit, really. Thanks. Next slide, please. So what do you need to write a good IHP? So a template is really helpful, so you're not starting from scratch, and there's lots on the internet, and I'm sure Kate and the MNIS Suffolk can point you in the direction of some charity-based ones. An open mind, so thinking not only about the practicalities, but what are the whole range of impacts, including social, emotional, psychological, and so on. What information do you need to know and who has the information, and are you able to contact them? Thinking creatively, so your colleagues around the county and your people that you know within education will have probably got lots of different solutions. They might have come across a child with a similar condition or similar needs, and I know from working with schools how incredible they are at thinking up some really creative solutions to problems. So talking to people and using the context that you'll develop through MNIS Suffolk will be really important. Getting everybody on board. So the child's medical team, I know in the hospital can be really difficult to access. So making sure that there's communication with the medical team about any issues that the child has in regards to their education will help to get them on board, because of course we all want the best for the young people. and making sure that we review the plan regularly. So for more complex situations, perhaps where a young person isn't accessing school because of their emotional needs, I tend to review it every 6 weeks. But for some young people, it can be as frequently as a 15-minute every 2 weeks, just to make sure that we're progressing with what the child needs. Thanks, Nicole. So some specific things to consider in a good IHP. So discussing right from the get-go confidentiality, getting consent from the child and their family to liaise with the medical team and other professionals. What information is it okay to share and how will it be shared? And this is often a time where any issues around safeguarding might crop up in terms of any concerns that families might have about contacting other professionals, and unpicking that a little bit more. How do you know in school when a child's medical condition changes and the circumstances change? How are you going to get that information? Will it be the family? Will it be the school getting copied into clinic letters from the hospital and delineating all that from the start? How does the young person want to talk to their peers about their medical condition and medical needs? Some young people will not want people to know anything. Some people will be very open, and the hospital team often have outreach nurses for specific medical conditions that can support a school, where maybe it would be helpful for the class to know a little bit more about the practicalities or impacts of the medical condition. So do reach out if that would be helpful. How does the child want you to be? Are they happy for you to ask about their medical condition, or would they prefer just to school to be a safe place where the medical side of things is not discussed? So having that conversation can avoid some unhelpful situations further down the line. Thanks, Nicole. Who will be this child's staff link member? So it's usually helpful to have one named person at school who links in with the child about their emotional needs, their practical needs. Who can they go to? And perhaps naming that person and maybe one other, just in case that person's off sick, can be really helpful. Thinking about the child attending school. So if the child is unwell, how does that get communicated to school? If the child is coming in a bit later, how is that communicated? And really having a good setup so that we don't get in any difficult situations about attendance that can be avoided, but also the school can plan and accommodate, because it's not always easy, obviously, when a child is coming in perhaps part way through the day, or when you don't know if the child is able to attend or not. Thinking about reduced timetables, social opportunities are always a good starting point, or maybe not always, but for most young people, they will be a good starting point. And a timetable that's reduced should always include social opportunities, so break times, lunch times, and any lessons that perhaps have additional goals and outcomes in addition to the academic learning side of things. If the child is in school, how will they indicate that they're tired or unwell? So some schools obviously have like a pass system or a card system, and some schools come up with really creative ideas of a signal or a word that they can use with their teacher, particularly if they're feeling uncomfortable about their medical needs and signalling. In terms of some questions to ask, I think we might have lost Nicole. Shall I share my screen, Kate? Let's go with plan B.
Yes, that would be really good. Thank you.
I'm hoping I'm going to seamlessly. Can you all see that?
Yes, we can.
Fab. I'm gonna share my screen now. I hope you can all see that.
Yeah, apologies for that. Nicole is presenting from the hospital, and the hospital Wi-Fi is never particularly good at this time.
Thanks, Kate. Just to make you all aware, I can't see any of you on the chat now, so I'm going to keep talking, and then hopefully I can unshare my screen and see the chat when I'm done. So how they're indicating they're unwell, ensuring that you've got all the key contacts, including backup contacts and the contacts of the medical team, and just thinking about not just the impact of the medical needs on education, but other aspects of well-being, child self-esteem, how they feel in terms of difference to their peers and so on. Thinking about what you might be asked to implement, so reduced timetable, separate room, but being comfortable to ask questions about the rationale for some of these things. So whilst they might intuitively seem helpful, linking in with the child's medical team or the psychologist involved might actually be revealing in terms of some things might be a bit of a safety net, but might be unhelpful in the long term, particularly in terms of overcoming anxiety and so on. And knowing in your local area what supports or resources do you have to inform your work. So accessing the MNIS team who's very familiar with lots of the different templates and so on, but also working with young people with medical conditions. So we know that young people have a number of preferences in terms of their medical needs. So they tell us that they want staff across the board to see the individual, not the condition. So thinking about, asking about activities outside of hospital, what they like doing, what their achievements are, and making sure that's all taken into account in the IHP as well. How can you access the full range of education and everything that brings, not just the practicalities of the medical condition. Not having to explain repeatedly. So if a young person's been off school and they haven't done their homework, how does that get communicated across the staff team? Similarly, if they have any special adjustments within the lesson, like having a water bottle with them, for example, so that they don't have to explain in front of the class. Not being out of sight, out of mind. So thinking about how they can be kept in contact with teachers and pupils, maybe a weekly email if they're out of school for a long period, maybe the school sending things home, photos and so on, and just being kept in mind. Thinking about social opportunities as well as schoolwork. So again, that speaks to the holistic needs of the child, not just the academic attainment, but making sure that they keep in touch with their friends. And thinking about one of the helpful things in the pandemic is how far technology has come along. So we can think about Zooming young people into class, maybe even use of robots, for example, and just how we can keep children right at the forefront of our minds when they're not able to be physically present in the school environment. So some good ideas that schools have come up with. So lunch or break time video calls with friends. So many schools have used Microsoft Teams to dial in friends, and they've had a couple of kids in the classroom to do that. Letters and drawings from classmates, remote presence through robots or Zoom or Microsoft Teams and so on. Recording lessons for later viewing. So you can record PowerPoints these days. You can record an audio of the lesson. Thinking about robot technology. So in Oxfordshire, we have the Robots in Schools project. I'm not sure if you have similar in Suffolk, but it might well be that you do. Thinking about focusing on what a child can do. So, for example, we had one young person that couldn't play football because of the risk of getting hit on the head, but the risk assessment was that they could take penalties, for example. So that can be really helpful to think about what are all the options available. We know that activity has to be meaningful, so it's sort of not enough to do things in a way that's not meaningful. So making sure that a child is not just submitting work, but they're getting feedback on it. They're getting individualized feedback and an acknowledgement that their work has been submitted when they're not in school. And thinking about things like certificates, special mentions. So maybe you could let the class know that that the young person has done really well in a piece of work and record it and send it to the young person. So really thinking about how can they meaningfully be included in school life, even if they can't be in class all the time. So thinking creatively about an IHP, here's some examples of real life IHPs, obviously anonymised. So I like to use the what, why and who format that I've got here because I think it's helpful to be really specific in terms of the what. Developing a shared rationale can be really important, especially when some advice seems counterintuitive. And who really delineates who's going to be responsible for doing it so that there's some accountability there and that everybody knows what their role is. So in this first situation, Leo's given 30 minutes of English and maths per day. That can be completed at home when he's too unwell to attend school. So this was to ensure that this young person had something to do when they're not at school. And sometimes things can be quite, quite vague, like check online what work has been set. But actually, when you're feeling rubbish, if you have to go and suss out what is there, what is available, that can be really tricky. So as specific as you can be about what there is available to do. This is a young person with chronic fatigue, so also ensuring a consistent level of activity, so knowing what the expectation is will help fatigue management and to ensure that some learning is accessed even if not in school. So this was agreed with the medical team as appropriate to this young person's needs at the time. The class teacher was responsible for providing to mum at the beginning of each week a list of exactly what could be accessed, and mum was responsible for dropping the work back into school at the end of the week. The second person was given a lunchtime queue jump pass and was asked to, was given this at the beginning of the lunch break to use. The rationale for this was, although the young person could physically stand in the queue, which was one of the questions, we know that the more the young person stood in the queue, the more likely that they were to have what they termed meltdowns. So this young person had a lot going on in their life. So whilst we didn't see the lunchtime pass as being a permanent thing, it was an acknowledgement about how the young person at that moment in time was learning strategies to manage what was a very difficult time. And we just needed to reduce the stresses in the school environment for a short period whilst some of that settled down. So the head reviewer provided the pass and communicated to the lunchtime staff. And there was some concern about whether the pass would be sort of misused, shall we say. So we had a system in place for feedback if that was the case, and we all agreed that the usual school procedure would be followed if there was any misuse of the pass, such as messing about or anything like that. So really clear the what, the why and the who. So just to summarise some overarching principles, the child's needs should be at the core of the planning of the IHP, but all staff involved in the child's care should be party to the development of it. And there should be ample opportunity to ask questions of the medical team and to discuss the rationale behind certain aspects of advice. There should be maintenance of the usual boundaries within the school environment, but with an allowance for the medical needs, including the psychological needs of the child. So for example, you know, if a child behaved in an unacceptable manner, such as hitting another child, you would still follow the usual procedure, but the IHP might allow for and delineate some of the supports a young person needed, such as school counselling and so on, to support them with emotional regulation. Making sure that you've got all the information that you need to support the decisions, and if you need more information from the medical team, how do you go about getting that? Making sure the IHP contains all the important information and context that you need from the get-go. Thinking about the social and emotional impact on school in addition to the educational and physical needs. Thinking about how you're going to communicate and checking in throughout. How is the IHP going? Is it progressing? What does the review need to look like? And most importantly, ensuring that the IHP includes the child in all aspects of school life as much as possible. So thank you so much for listening. Apologies for the tech issues, and I'm not quite sure why the slides seem to have a mind of their own, but hopefully we got through it. I'm going to unshare my screen, hopefully, and so I can see the chat and I can see anybody that wants to ask a question. So thank you, Kate. Just having a look through the chat. So, yep, you've got robots in schools in Suffolk, and Kate's kindly put the email address in there if anybody wants any further information. Has anybody got any questions or comments?
Well, I think you've covered everything so well, so brilliantly, Helen, in your usual manner. So thank you. I often get asked the question about IHP versus EHCP, that question. If they have an EHCP, do we need an IHP? But I think you've covered that very well in the fact that what I've taken from it is that it's basically the local teams deciding if an IHP would be beneficial for that young person. If they have an EHCP and we don't feel that it's particularly addressing some of their social needs and some of their sort of emotional well-being, perhaps, then an IHP would be appropriate. Is that right?
Yeah, absolutely. I think the EHCPs can be so helpful in terms of delineating lots of lots of what the child needs, but there will be some things that are particular to, their psychological well-being, emotional well-being, which probably are not included in the EHCP, that you notice on a local level would be helpful. That they're not part necessarily of the provided support, but still would be useful to delineate. So things like, how are we going to communicate as a staff team about this child's needs? So if their usual teacher is off sick, where's the information for the supply teacher? Or how does this child want their medical condition discussed within the school environment? Are they happy to take questions? Would they rather not? That's unlikely to be in an EHCP. So if you have a child with emotional needs, who's really struggling with their medical condition, having that in an IHP might be a helpful adjunct. If you have an incredibly detailed EHCP that seems to cover the child's needs, then I would say don't create more work for yourself and duplicate.
Thank you, Helen. That's really helpful. And I know that we've even got people joining at this point. So we've had real technical issues, haven't we, today? So I apologise for that. Are there any other questions that anyone would like to ask Helen while she's with us? I'm going to put my camera back on. There's one more question that I have, and that's just about specifically to asthma and IHPs, children that have asthma. What's your view on, because you could have 5 or 6 children in a class with asthma, and I often get asked this question, what do you feel about an IHP?
I think it depends on what the child's needs are. I think some children with well-controlled asthma, where adherence to the medical regimen is good, they know what to do, there's never been any problems, they seem well adjusted in terms of their condition, feeling of difference. I think any child with a health condition is entitled to and could have an IHP. Is it necessary? I mean, if you've got your system in school of documenting all that and it works well, I would say don't. If it ain't broke, don't fix it. If it ain't broke, don't fix it? Is that the saying? You know what I mean. But actually, you will have some children with asthma who also have anxiety, and can be difficult to delineate what's an asthma attack, what's a panic attack. You can have some young people maybe reluctant to take their inhaler. Maybe some children where they have more triggers in the school environment around PE and exercise. Maybe they feel different if they have to go to the office and take their inhaler, if they have hospital admissions and so on. So I think it would very much depend on what the needs of the child are and whether it seems necessary. I hope that answers your question.
I suppose at this point we should mention our toolkits, shouldn't we? We've put together, well, Oxford, you've put together 4 on pain management. Now you're going to test my memory. Pain management, chronic fatigue syndrome, anxiety, and one more.
We've got a few more forthcoming. We've got some on cancer. I know you guys are working on diabetes and cystic fibrosis. And I think we've got one on sight loss. There's quite a lot forthcoming, medically unexplained symptoms. So yeah, absolutely. Hopefully lots of resources come in. And just to mention, I can see Therese has put in the chat, she uses the asthma care plan, which the school nurse, I'm presuming, or the child's respiratory nurse might fill in. So that might be something like the asthma care plan might be sufficient for that child's needs. But if you notice maybe the child's feeling different, if they need that extra support, an IHP can be a good adjunct to that. And I can see Julie's popped in the chat about where do we find these. I know the ones that we have already are on the MNIS Oxon website. I'm presuming, Kate, you've got somewhere to keep. Have you got an equivalent of yours?
So if you go on the Radworld Trust website, at the top it says MNIS Suffolk. And if you scroll down there, then you've got resources, and it's in there, the toolkits. We've only put 4 up at the moment. We're still waiting for quality assurance for the cystic fibrosis and the diabetes one that we have done. So they are in the pipeline, ready to be put up there, probably in the next few weeks.
It's me holding them up.
I didn't like to say
that myself. You're very kind, Kate, not mentioning that.
So I think we, unless anyone's got any more questions, we'll draw the workshop to a close and say thank you very much for your advice. It's always very clearly and succinctly put. So thank you very much, Helen, for joining us today. And for everybody else, our next Medical Needs in Schools workshop will be held on the 27th of September. That's a Monday again. I know Mondays isn't always brilliant, but that's going to be at 4 o'clock. And it's going to be on asthma. And our guest speaker is going to be Dr. Imogen Rose, who is a consultant paediatrician here at Ipswich Hospital. So thank you again for joining us. The slides will be on our website and also this recording, so you'll be able to access it and certainly share it with colleagues at a later date if necessary. So thank you again, Helen. Lovely to see you, and take care, everybody.
Thanks, everyone. Bye.
Thanks, Anne. Bye.
Bye.